Hello, I am Imani Taylor, and I'll be doing the evidence-based dentistry portion of today's presentation. I developed my PICO question, and that was, in patients with removable partial dentures, do acrylic resin denture bases have lower failure rates compared to cast metal denture bases? My population was patients with removable partial dentures. The intervention was acrylic resin denture bases in comparison to cast metal denture bases, and I looked for an outcome of lower failure rate. My working set was acrylic and RPD, or removable partial denture, and failure, and that yielded 54 results when I ran it on PubMed on October 19th, 2025. And this is a snapshot of my search method. My first article is a systematic review that was published in February of 2023, and the second is a retrospective analysis that was published in July of 2024. The first article was the technical complications of removable partial dentures in the moderately reduced dentition, a systematic review. And the PICO question they developed for their study was broken down here. So the population was patients with moderately reduced dentition, an intervention of therapy with some type of removable partial denture in comparison to therapy with some other type of removable prosthesis, fixed prosthesis, or leaving the situation as is. And they searched for an outcome of information on time-related technical failure or complication rates. The PRISMA guideline served as the basis for this study, and the last search run on PubMed was done in June of 2025. They also searched for articles by hand, and they stopped doing that in 2014. The inclusion criteria for studies that could be utilized for this systematic review were data on time-related technical failures and/or complication rates. They included randomized controlled trials, prospective and retrospective controlled clinical trials, as well as longitudinal studies, and the articles must have been written in English or German. The exclusion criteria were studies that included patients that had less than 3 remaining residual teeth, studies that had a number of cases that was fewer than 15, if there was a dropout rate higher than 25%, and studies without an adequate definition of inclusion or failure criteria. In this systematic review, 10 randomized controlled trials, 3 prospective studies, and 30 retrospective studies were used. The mean observation period was between 2 and 10 years. Treatment took place in universities, but also military hospitals, and treatment was also performed by dentists and students under supervision. There were a lot of analyzed parameters, but the ones I thought to be important in relation to this case were retention of the prosthesis, fracture of the framework, fracture and repair of the denture base and/or saddles, and relining and rebasing. One of the studies used in the systematic review found that most clasp fractures occurred in short clasps, and 22 out of the 27 fractures were related to Kennedy class 1 and 2 RPDs, or RPDs with distal base extensions. Only a few remakes of the prosthesis were required due to clasp or framework fracture throughout all the studies. In another study, it was found that 2 supported prostheses showed higher survival rates compared to extension-based prosthesis, and relining and rebasing, as well as denture teeth fracture, were mentioned as the most frequent complications across all studies. The strengths of this study included that the majority of publications clearly differentiated between a crack and a fracture, the inclusion criteria of patients having at least 4 remaining teeth, and the timeline of the data search and publication allows for up-to-date recommendations. The limitations of this systematic review were that not all the publications listed inclusion and exclusion criteria. There was variability of study designs, and it was impossible to do a meta-analysis and forest plot due to that variability. The fracture of the denture base may have been related to the need for relining, but that was not investigated or reported in any of the studies that were included. And there was no clear definition of what counted as a failure versus a complication. My next study is a retrospective analysis, and that was longevity of acrylic and cobalt chromium removable partial dentures, a 10-year retrospective survival analysis of 1,246 denture-wearing patients. The inclusion criteria for this study were adult patients 18 or older who received a wrought wire clasp, acrylic resin, or cast clasp metal-based RPD, and there was a minimum follow-up period of 3 months post-denture insertion. The exclusion criteria were patients younger than 18 that received an RPD, patients who attended for minor denture adjustments, patients with RPDs that were made of more flexible material, and studies without adequate definition of inclusion or failure criteria. Potential factors that affected RPD survival were evaluated using the Cox model. After exclusion criteria were followed, 11,499 visits between 2010 and 2021 from 4,255 patients were identified for the study. And out of about 3,700 RPDs that were delivered at the university clinic and had follow-up appointments, 1,893 RPDs were followed up for more than 90 days. Acrylic RPDs had a median survival rate of 45 months, and metal-based RPDs had a median survival rate of 73 months. And here you can see the p-values of the things that made the RPD survival longer. So number of maintenance visits after 3 months, number of maintenance visits within 3 months. If a patient had both a maxillary and mandibular RPD, and if the patient had a psychiatric condition, those all affected the survival rate of an RPD. And as it relates to the psychiatric condition, it's stated in the paper that a decline in mental health was related to a decline in oral health, which affected the survival rate of the RPD. And if the RPD was metal-based, it had a longer survival rate. The strengths of this study were that there was a clear statement of how RPD survival was assessed. So if a new denture was delivered, or a tooth needed to be replaced, or an abutment tooth was extracted and there was a need to place another tooth, that was considered a failure. The study identified statistically significant factors that impacted RPD survival outside of just clinic, but also took patient-related factors into consideration, like medical history, home care, social factors, and the length of the study. It was about 11 years. The limitations of this study were potential biases due to the study design, the fact that the study was done in a university setting, so it doesn't really reflect what happens in practice. We just have this based on a university. And because it was at a university, there was also variable operator experience because students were delivering these RPDs. And there was no reference to patients' previous occlusal scheme. And occlusal scheme really impacts whether or not a tooth might fracture, a denture base might fracture, there's too much force when biting, things like that. And in conclusion, while metal-based RPDs are recommended and have a longer survival rate than acrylic resin RPDs, due to the patient's financial limitations, the treatment plan for this patient will be an acrylic resin-based RPD. Thank you.